This is the Northwest Training and Development Team and Pathways Daily Coronavirus Update. Today's update is about the law that supports us to make our own decisions. The law that we use to support us in making our own decisions is called the Mental Capacity Act. This law also helps us to work out what we should do to support people who might need extra help to make decisions. It's important to know that while some other laws have had to be changed during the coronavirus outbreak, the Mental Capacity Act has not been changed. But the coronavirus might mean that the extra support we would have given someone to help them make a decision might have to be given in a different way. The principles of the Mental Capacity Act say that we should assume that everyone is able to make their own choices for themselves. We should do everything we possibly can to support a person to make a decision for themselves by giving them extra help. The Mental Capacity Act also says that just because someone makes a decision which other people might think is not very wise, it does not mean that that person is unable to make decisions for themselves. If an assessment finds that someone is unable to make a decision for themselves after they've had all the help they possibly can, then the decision must be made for them in their best interests. We'll talk about this some more. The final principle of the Act says that if someone is not able to make their own decisions and a decision maker is thinking about what should happen in the person's best interests, that decision maker must think about the least restrictive choice. What's really important is that during the coronavirus, we need to think about how we can support people under the Mental Capacity Act, and this might be different. Usually, when we're supporting someone to make their own decisions, or trying to work out if they are able to make a decision for themselves, we would meet that person face to face. This might not be possible right now. We should still do everything that we can to support the person, keeping with the principles of the Act that we talked about earlier. This might mean speaking to someone on the phone or over the internet. We should do everything that we can. If we are having to make compromises and not do things in the way we would normally like, then we should review the decision as soon as we can as things become safer. If someone is assessed as not being able to make their own decision, or lacking capacity as it's known in the Act, a decision that has to be made and can't be put off until later must be made in that person's best interests. It's not about what's in the best interests of other people. This is important during the coronavirus outbreak. It means someone can't make a decision, say, about you leaving your home to protect other people. A decision must only be made about how you will be affected and what it means for you. No blanket decisions can be made for groups of people. For example, if someone lives with a group of other people in supported living, a supported living provider can't make a decision for everyone. There have to be separate assessments and there have to be separate decisions in the best interests of each person who lacks capacity. Even if someone is unable to make a decision for themselves, the person must still be involved in all decisions about their health, their care, their support, and every aspect of their lives. Even during the coronavirus outbreak, people must be involved in decisions about their lives. The Mental Capacity Act has not changed during the coronavirus outbreak. But to keep each other safe, the way that we support people under the Act to be involved and make decisions for themselves might be different. We must still remember that people who are unable to make decisions for themselves must have decisions made for them in their best interests and not the interests of other people.